If you've been trying to treat your depression for a long time, going to therapy, doing self-help, taking various medications, and not finding much success, you may have asked yourself what you're doing wrong or why these treatments aren't working for you. You may have asked yourself why the person you're seeing just can't get your symptoms under control. Well, another question you should be asking is, are you actually seeing the right type of provider? Coming up, we'll take a look at the various providers who can assist in your mental health treatment so you can understand the specific roles of each one, which may help you in making a change to your treatment team if you need one. Hi everybody, my name is Julia Swofford. I'm a psychiatric nurse practitioner, and this is Real Talk Mental Health in Vancouver, Washington, where we talk about mental health treatment from the provider's perspective. If this kind of content interests you, please click the subscribe button and that little bell, which will notify you when we release new videos. Okay, so the healthcare field is full, as you know, of a lot of different types of professionals trained at varying levels, often to do a very specific job in healthcare. Even among mental health professionals, you'll find tons of different providers who can all help you with mental health symptoms. And some of these roles will naturally cross over, but they all still do have a very specific training and expertise. In my experience, most patients are understandably confused about who's who. I've had new patients come to me very confused about why they're even coming to me. Sometimes they may be expecting therapy or even referred for therapy and are surprised or even disappointed that I offer mostly medication management and TMS consults. To be really clear, I'm not promoting one profession or credentialing over any other or saying that you should see a specific type of provider. There's a gaping mental health need and no end of people needing mental health services, so that wouldn't even make sense. If you're happy with your mental health provider and are getting your needs met, that is key. My goal here is to provide an overview of the types of providers you can access in mental health treatment. So if your needs are not being met, you can consider a provider change to open up your treatment options. Okay, so mental health providers divided into two main groups: those who prescribe psychiatric medications and those who provide psychotherapy. Talk therapy. Let's start with the people who provide psychotherapy. Okay, there's a lot of people out there, including various healthcare providers, who can offer emotional support or give really great advice about lifestyle changes that can help you have better mental health. Sometimes a good venting sesh is really helpful, but that's not actually therapy. A very skilled life or health coach can provide that kind of thing, and that might be exactly what you need. There are only a few designated professionals who have been specifically trained to provide evidence-based psychotherapy. Therapists have a master's or doctorate degree and have completed thousands of hours of supervised clinical hours post their degree, and they give more than advice and emotional support. Okay, so some of the main groups of professionals in this category are licensed professional counselors, or LPCs, licensed clinical social workers, LCSWs, licensed marriage and family therapists, LMFTs, and clinical psychologists. Those people have a PhD and can also do psychological testing. That might be a good idea if you feel that your diagnosis doesn't quite line up with your symptoms, or if you continue to have really strange reactions to medications that are supposed to be helping you. Therapists provide evidence-based therapy, which means the strategies they use in the therapy are based on accepted theories of psychology and were developed by researchers and studied in groups of people to show that those interventions actually produce statistically significant improvement for a majority of people. The most common type of therapy is called cognitive behavioral therapy, or CBT. Other examples include psychodynamic therapy, parts therapy, acceptance and commitment therapy, or ACT, ACT, dialectical behavioral therapy, or DBT, interpersonal therapy, and EMDR. Don't be shy about asking your therapist about your treatment plan. If they are a trained and licensed therapist, they will have one. Ask them about what type of therapy you're having if you're not sure. When it comes to medication prescription for mental health symptoms, you'll also find a couple of different providers and professionals who can prescribe. For mild to moderate mental health symptoms that are being treated for the very first time, a primary care provider or pediatrician is often a really good place to start. These professionals, including MDs, DOs, physician assistants or PAs, and family nurse practitioners or FNPs, have a working knowledge base and skill set in a lot of different areas of health, including mental health, and can start a person off with the first one or two trials of psychiatric medication, especially for depression, anxiety, or insomnia. Starting with your primary care provider is a good plan because care is already established, so they already know you, and it's easier to get an appointment without having to wait weeks or months for your visit. Even if you don't already have a primary care provider, you'll probably get an appointment sooner with them than with a psychiatrist or psychiatric nurse practitioner who can have weeks to months of a waiting list. If the first few medications you try aren't effective or you have unexpected reactions, that might be the time to see a prescriber with a psychiatric specialty. You may also want to see a psychiatric provider if you have a more complex psychiatric condition such as bipolar disorder or schizophrenia. Some primary cares can start with the first or second medication for those. Often it comes down to the comfort level of that specific primary care provider. That's especially true in ADHD treatment. ADHD treatment's pretty simple and straightforward, but some providers feel uncomfortable with the use of controlled substances. Some will require psychological testing first to prove the ADHD diagnosis. Prescribers who specialize in psychiatric medication management include two groups, psychiatrists and psychiatric nurse practitioners. Psychiatrists are trained in all areas of medicine while in medical school. They have a medical doctorate and they complete a psychiatric residency after graduation and take board exams in psychiatry where they can be board certified to treat adults, children, or both. Psychiatric nurse practitioners like me either have a doctorate degree or a master's degree in psychiatric nursing, which they can only get after completing a bachelor's degree in nursing, where they're trained in all areas of nursing. Nurse practitioners practice independently of a physician in some states, but not in others. Some states require psychiatric nurse practitioners to complete a state-specific residency after school, and some don't. Psychiatric nurse practitioners are also board certified to treat either adults or kids or both. Having both of these professionals is really wonderful because it provides more access to specialized psychiatric med management. Both of these professionals are also trained and licensed to provide psychotherapy, and some do a really great job. Though, due to an ever-growing need for both therapy and psychiatric med management, some psychiatric medication managers choose to just focus on the medication part to open up access to that and leave the therapist to the very competent therapists who are the experts in this field and do that all day, every day. Some people choose to work with a naturopath. Some naturopaths have found a special niche for treating mental health symptoms with vitamins, minerals, and supplements. That can be really helpful, though unfortunately it is somewhat limited in its true evidence base, meaning there are lacking randomized controlled trials to test efficacy, and also it lacks regulation by the FDA, which would offer safety guidelines. When psychiatric medications aren't effective, aren't tolerated, or not wanting, but depression is ongoing, there are other advanced treatments that we've talked a lot about, like TMS, Spravato, vagal nerve stimulators, ECT. These are always given and supervised through a psychiatrist or a psychiatric nurse practitioner. Okay, I hope this information was helpful, especially if you are in need of different types of treatments, your treatment's really not progressing, and that being armed with specific information about the various providers you'll come across will help you feel more confident in finding the right healthcare team for you. If you're ready for TMS, that's what we do. We'd love to help you learn more. We'd love to help. Please give us a call. If you're in the Portland and Vancouver area, call us specifically here at TMS Northwest. We would love to help you and be a part of your treatment team. Take care.